controlled, that can be delayed or controlled?
It's a natural phase every woman will go through.
Sorry, doctor. Maybe we better start this way.
Yes.
What is the age range for menopause?
Well, the average age of menopause globally is 52.
Okay.
But there are racial differences. For example, I think in this environment, a number of women will go through menopause in mid-40s, from the age of 45 onwards. In other communities, Asian communities, perhaps because they have a culture of not talking about it, you tend not to see their symptoms, their complaints until much older, the late 50s. But globally, it's about the age of 52 is what the average age of menopause is.
Okay. We'll come back to the treatment or prevention later on, but right now we'll take a little break. We'll be back after the break. You can come on with your questions then in a moment. Welcome back. You're still on to Health Matters, and we're talking about possible prevention, or shall we say delaying the symptoms. So how do we do that?
Well, you can't delay the symptoms. You can take things to ameliorate them.
Okay.
For example, lifestyle changes. The people that smoking is known to exacerbate symptoms. So if you stop smoking, exercise improves your general well-being. Alcohol intake, reducing alcohol intake, reduces the incidence of the intensity of vasomotor symptoms. So there are lifestyle changes you can embark on before you come to the issue of medication.
Okay, but there is the issue of medication. Do they have something like estrogen tablets or something? I mean, because it's all connected to estrogen and it affects the whole body. So, you know.
Yes, yes, you have hormone replacement therapy.
Okay.
Now, because like you said, the hormone is estrogen, and the aim of the treatment is to replace the estrogen that the woman no longer is making in adequate quantities. Now, there are several ways by which estrogen can be administered. It can be administered orally, tablets, there are patches, there are implants, there are creams, and the right kind of mode of administration will all depend on the individual and the doctor.
Okay. Now, this replacement therapy, does it come without consequences? Are there side effects or things like that attached to?
Right. Now, hormone replacement, when people talk here about HRT or hormone replacement therapy, it rings, some people get very, very scared. The reason is that about 10 years ago, or a little over 10 years ago, there was a huge study, a WHI study in the United States, which came out with the findings that women who went on hormone replacement therapy had more incidences of heart attacks and coronary artery disease.
Okay.
And the study had to be stopped on this for that reason. But analysis of the data subsequently showed that there are two distinct groups of women who use HRT. There are those young women who are just growing into the menopause. And there are older women who have been menopausal for over 10 years, for example, and are beginning to use HRT because of osteoporosis, bone loss.
Okay.
Now, the two groups are totally different and behave differently. Now, the most common, and when you look at the young women who are going through menopause, that is the women in their 40s and 50s, there are no significant adverse events in terms of the major ones. The two concerns we have are breast cancer and endometrial cancer, which is cancer of the lining of the womb.
Okay.
Now, the data available shows that women who are on hormone replacement therapy, compared to those who are not, over a 5-year period of use of HRT, there is no increase in the risk of breast cancer. All right? That's a very important message because that's something that really scares women. Now, if you take it on further to women using HRT for 10 years, there is a marginal increase in the risk of breast cancer, marginal. But when you look at the risks versus benefits, in 9 times out of 10, the benefits outweigh the risks.
Okay, so these benefits now, when a woman starts to get this HRT, does it totally wipe out the symptoms of menopause, as in no more hot flushes, no more night sweats and other things?
Yes, what it does, it stops the menopause. All right, all the symptoms are arrested immediately. So bone loss is stopped because bone loss is accelerated when women go through menopause. So that is stopped. The cardioprotective effects, that is the protection that women have on their cardiovascular system, is also maintained.
Okay.
The hot flushes, of course, are the first symptoms to disappear, and those will disappear within a week of taking HRT. That those will stop. So eventually, what you're doing is you're suspending the menopause, because, and then the question then comes is, how long do I take this for?
Exactly.
Now, we know that the acute symptoms of the sweats and flushes will stop on their own after maybe 2 to 3 years. Okay, so it can be argued that you should take HRT for just 3 years and then stop and see what happens.
Okay.
But the duration of use is really an individual thing, but I would say a minimum of about 2 to 3 years. Some people would say go up to 5 years and then see what happens. Because when you stop the HRT, if there is a possibility that the symptoms may return. However, if you have gone past that stage, your body has gone past that stage, then you may stop the drugs and find that you're living a perfectly normal life.
Okay, so we're talking about younger women now.
Yes.
How about the older ones who are receiving treatment for bone loss? Is there the option of gradually reducing the dosage?
Well, that is no longer an indication for using HRT, because there are other. If you want to treat bone loss or slow down the rate of bone loss, then you use another group of compounds, the bisphonates. They are more effective and don't have the side effects of estrogen.
Okay, so what happens to a woman who has had her womb surgically removed? Does she have a quicker onset menopause, or does it affect anything?
Yes, if that's the organ that is responsible for producing estrogen, the ovaries. And there are two, the womb can be removed leaving the ovaries behind, or the womb can be removed taking the ovaries as well. Now, if a woman has a hysterectomy, that's what we call it. If a woman has a hysterectomy at the age of 40, for example, it is unlikely that the doctors will take out the ovaries at the same time. So she would not suffer the symptoms of the menopause straight away. However, if she's 45 and she needs to have a hysterectomy, the recommendation is that the ovaries should be taken out at the same time. Such women would be thrown into menopause straight away. They would have what we call a surgically induced menopause.
So that depends really on the ovaries?
Yes.
Okay. Finally, I have one last question for you, doctor. And the question is, do men go through any sort of pause of their own?
Well, there is something which is called the andropause in men. It's not as alarming as it is as the menopause, but yes, there is an entity called the andropause.
I'm sorry, I have to stop it there. They're signaling me and our time is up. Thanks for coming for the program. It's been wonderful having you.
My pleasure.
And thank you for being with us too. It's been wonderful having you. Enjoy the rest of your day. I'm Mary Alale Yusuf.